Congressman Tom Price, chairman of the Republican Study Committee. Congress is in recess. Now, there's a lot of people very upset about the Obamacare proposal. And a lot of congressmen, I suspect, are hearing what they may not want to hear from some of their constituents. What do you think people should be telling their members while they're at home?
Well, the first thing I know is that when Congress is in recess, you're safer. When Washington isn't in session, you know that your wallet is safe for a short period of time. The big thing is this deal that the Blue Dogs made. Well, what the deal didn't do is end a government program, end the government takeover of medicine. What the deal didn't do is end an employer mandate, end requiring employers to purchase health insurance so that you lose jobs. 4.7 million jobs is the estimate. So what they ought to be telling the Blue Dogs, what they ought to be telling the folks that made this deal is that's no deal for us. It's no deal for the American people. It's no deal for the patients across this land. Let's get back to patient-centered medicine. Let's put patients and their families, along with their doctors, in charge of health care. We've got a great proposal. Hope you look at it.
Well, tell us a little bit about that proposal. The Republican Study Committee introduced this just before the recess. What's the difference between your bill and the Obamacare bill?
Well, it's night and day. What we do is make it so that everybody across this land can financially find the wherewithal to be able to purchase health coverage. We try to fix what's wrong with our current system, but retain the wonderful qualities of the system. We know that portability is a challenge. If you lose your job or you change your job, you're worried about losing your health insurance, you're losing your health coverage. We make it so you can take it with you because you own and control the policy regardless of who's paying for it. We believe strongly that quality ought to be defined by patients and their families and doctors, not by a federal bureaucrat sitting in your exam room, sitting in the clinic room, or worse, sitting in the operating room telling your doctor what he or she has to do. And we would end the frivolous lawsuit challenge. We've got wonderful reform in the area of liability so that we end this lottery mentality for malpractice suits. And finally, we don't raise taxes a dime, not a single dime, to be able to cover our plan.
Dr. Price, thanks. We'll see you in September.
Thank you so much.